into it, you have an idea of what you're going to experience, and the hope is that you eventually get to where you want to go, which is probably someone that doesn't have pain, able to engage in their life as they want to. I think where we deal with that side of things is you can be as prepared as you need to going into surgery, but the other side of surgery is the challenging part where you can lose a bit of perspective, or you need someone to tell you, hey, you're actually doing really well, or look, this is where you progressed from last week to this week. So a big part of our role is coaching a patient through their post-op recovery, reassuring them, sometimes pointing out when things need to be improving a bit quicker or we need to really push into an area, but definitely patient expectation is something that we work with, and it's probably the most valuable part of our program, arguably, is just helping a patient understand what they're experiencing and making sure they're comfortable and feel supported through that journey too.
When we first meet the patient, we obviously go through the standard paperwork side of things. In terms of chatting to them, we want to know what their history is, so around what brought them to having the surgery, past medical history. We also chat about how their pain is, medication wise. We also want to know their social history, and that's particularly important because we use that to set their goals. So we don't want to just have these typical standard goals. We want to make them very individualised, so that's why we got to learn what the patient is about and what they want to get back to. And then in terms of what we objectively measure, we look at their mobility, how they're moving in their home, like in and out of bed, in and out of chairs, just their standard sort of movements, looking at their range, their strength, and then, again, if there's anything specific in terms of their goals, we assess that. And we just that first session is really just reassuring the patient, because obviously we're providing the care of physio in the home. We need to transition from what it was like from in hospital to them being at home and making sure that they're comfortable, they know what they're doing, their pain's managed enough, and then we're working towards their goals.